迎大家嚟到
Welcome to today's press conference in relation to COVID-19 vaccination program. We have with us on the stage Mr. Patrick Nip, Secretary for the Civil Service, Professor Sophia Chan, Secretary for Food and Health, Dr. Edwin Choi, Controller of the Center for Health Protection, and Mr. Elmer Chen, Director of General Grades of the Civil Service Bureau.
Media friends and members of the public, I would like to talk about the local and international pandemic situation, and then I would move on to the expert committee's recommendation on the third dose vaccine. In the past few months, our epidemic situation has been stable. We have only recorded one local infection case on the 8th of October relating to airport staff member. Each day, we have only recorded single-digit imported cases, most of which have been identified on arrival or during quarantine. From the news, you would know that the global epidemic situation is fluctuating. The total number of infections globally has reached 240 million people. The total number of deaths has reached 4 million. Countries which choose to coexist with the virus are recording increased number of infection and fatality. Social distancing measures have to be tightened drastically. The mutant virus strain is affecting the whole world. However, we have recorded no local infection or community outbreak. It shows that under the zero infection strategy and the measures to prevent importation of cases and local outbreak, we have achieved a stable epidemic situation. It allowed us to relax the social distancing measures. Daily life and economic activities have resumed normality. This situation is not easy to come by. The governments and members of the public have to remain vigilant. As the society as a whole and individuals have to be well prepared so as to protect our health as well as create favorable conditions for cross-boundary travel in future. Today, we will talk about the vaccination program. The WHO and our Joint Scientific Committee have pointed out that the chief purpose of vaccination is not avoiding infection, but rather to avoid serious complication or even fatality in the unfortunate event of infection. It is necessary for elderly people to be vaccinated as well. Despite the easing epidemic situation, let's not forget that the fatality of the mutant virus strain is very high, especially for elderly people. Since the vaccination program, we have recorded a very low level of local infection. However, we can draw reference from international experience. For example, in Singapore, there has been an outbreak between May and September. For unvaccinated patients above 80 years old, the fatality rate is as high as 18%, which means 1 in 5 unvaccinated elderly people would pass away. For patients in the same age group, if they are vaccinated, the fatality rate is only 2%, which means 1 in 50 would pass away. In other words, the fatality rate of unvaccinated elderly COVID patients is 10 times higher than those vaccinated. That is the fatality rate. As shown by the statistics in other countries, vaccination is key in relation to the fatality risk of elderly people upon contracting COVID-19. The elderly people are the most vulnerable people in the pandemic. We have to do our best to protect their health. The Comirnaty and CoronaVac vaccines we are using in Hong Kong are highly effective in preventing serious complication and fatality of COVID-19. They can protect elderly people efficiently and prevent serious complication or even fatality for elderly patients. However, for elderly people above the age of 80, the vaccination rate is only 15%. In other words, 85% of elderly people are still at high risk. This is a very dangerous signal. The government will continue to facilitate and encourage elderly people to get vaccinated in preparation for the fifth wave. I appeal to the public to encourage the elderly parents to get vaccinated as soon as possible for the sake of their health. Concerning the recommendation made by the experts team on the third dose, as shown by international and local studies, having vaccinated for a period of time, the antibody level would decrease. The protection offered by the vaccines would decrease in time. As a result, the WHO recommends a third dose for specified groups of people to protect them against the coronavirus, especially the highly transmissible mutant viral strain. On the third dose, the Joint Scientific Committee under the Center for Health Protection and the Chief Executive's Expert Advisory Committee has had a meeting last Wednesday. They have visited the latest scientific proof and the recommendations made by the WHO and overseas authorities. They have reached a consensus recommendation on administering the third dose in Hong Kong. In accordance with the recommendation made by the experts team in the past week, we have been preparing for administering the third dose. I will now announce the details. In short, we would take the advice of the expert team to arrange the third dose for a specified group of people on a risk-based and gradual manner. The prioritized groups include several groups. First, immunocompromised people in certain groups. For example, cancer patients, patients with organ transplants, late-stage AIDS patients, patients who are on immunosuppressants, and so on. The third dose should only be administered at least 4 weeks after the second dose. The second group would be people of higher risk who have been administered 2 doses of Sinovac vaccines. These include elderly people aged 60 or above, medical healthcare staff, chronic patients, and those who are working in working environments with high exposure risk, and also frontline health workers, cross-boundary transportation workers, and those who work at border control points and ports. The third dose should only be administered at least 6 months after the second dose. Concerning the above 2 groups of persons, the experts recommend Comirnaty or BioNTech vaccine for the first dose because it would generate a better immune response than Sinovac. However, it is a personal choice. Members of the public can choose according to their own situations, and they can consult doctors if necessary. For people above the age of 18 who have been given 2 doses of Comirnaty vaccines, if they belong to the higher risk groups, they should only be given another dose, a third dose of Comirnaty vaccine at least 6 months after the second dose. We also respect the personal wishes of members of the public, so they can also choose Sinovac vaccines as the third dose. For those who have recovered from COVID-19, this is also a high-risk group. Currently, they only need to be vaccinated for 1 dose. However, they can discuss with the doctors whether they need to receive 2 other doses of vaccines after recovery. The second dose should be administered 6 months after the first dose. To take forward the administration program for the third dose, of course, we have to have enough vaccines in store. As we have announced, we have procured a total of 15 million doses of Sinovac and BioNTech vaccines. As at yesterday, we have administered over 9 million doses of vaccines. We will pay close attention to the need of the members of the public and roll out the third dose administration plan orderly. We recommend members of the public who have not been vaccinated for the first 2 doses to get vaccinated when we still have spare capacity. I reiterate, members of the public might be wondering about the protection offered by COVID-19 vaccines. I reiterate, COVID-19 vaccines can offer a certain level of protection against infection, as proven by many statistics. And most importantly, it can minimize the risk of serious complication and fatality. It can protect our public healthcare system from being overloaded. And this is also very important for protecting members of the public's health and life. And also, bear in mind that the protection offered by vaccines might decrease in time. Like other places, we are arranging for a third dose for specified groups of people. The mutant virus strain is highly transmissible. In the unfortunate event of a fifth wave, it will spread much more quickly than the previous waves. It would be too late if we start vaccination by then. Once again, we appeal to the members of the public, if you have not been vaccinated yet, especially if you are an elderly person, a chronic patient, or immunocompromised people, you will have high risk of serious complication and fatality upon infection. So please get vaccinated before the fifth wave comes. Thank you.
Mr. Nip, good afternoon, everyone. Today's press conference is about details of the latest arrangements under the vaccination program and arrangements in relation to the receipt of the third dose. The COVID-19 vaccination program started on the 26th of February. This is the 251 day. We have administered over 9.05 million doses, covering 4.62 million people. That they are the people who have received the first dose. That is about 68.7% of eligible population, that is those over the age of 12. 4.43 million people have received both doses. That accounts for about 65.8% of the eligible population. As the Secretary for Food and Health said last Wednesday, the Scientific Committee on Vaccine Preventable Disease and the Scientific Committee on Emerging and Zoonotic Diseases under the Center for Health Protection, as well as the Chief Executive's Expert Advisory Panel, had a discussion about recommendations in relation to the third dose. The government has taken into account recommendations of the experts. We have decided that starting from next Thursday, that is the 11th of November, eligible people under the specified groups may receive the third dose free of charge. Eligible members of the public may, starting from 5th of November, that is Friday this week, make appointments using the dedicated website of the vaccination program. In short, there are two groups of people who have priority to receive the third dose. They are those who are immunocompromised and those who are exposed to a higher infection risk. Groups of immunocompromised people are those who are cancer patients, transplant recipients, HIV patients at a late stage, and those who are on immunosuppressive drugs. their third dose should be administered at least 4 weeks after the second dose. The second groups are those who are exposed to higher infection risk. They are those above the age of 60, healthcare workers, those who are chronically ill, or people who work at places with a higher exposure risk. Say, for example, personnel participating in anti-epidemic related work, personnel providing cross-boundary transportation, or working at control points and ports. And this group should receive their third dose at least 6 months after the second dose. In relation to these two groups, experts recommend that receiving Comirnaty as the third dose may generate a better immune response. However, the choice is a personal preference. Members of the public may choose the type of vaccine as their third dose as they wish, and if necessary, they can consult the doctor. They can choose whether to receive CoronaVac or Comirnaty as their third dose. There are a number of ways through which they can receive the third dose. First, starting from this Friday, the 5th of November, eligible groups may make use of the dedicated website of the vaccination program to make an appointment to receive the third dose at community vaccination centers or to our general outpatient clinics under the hospital authority. The second way is to obtain same-day tickets at community vaccination centers, except the ones in private hospitals. The third way is for patients and visitors of public hospitals. They may make use of the vaccination station in public hospitals to receive the vaccination on the spot without any appointment. There are 7 such vaccination stations. Starting from Friday, we will add 2 more. They are one at Pok-Oi Hospital and the other one is at the North District Hospital. In other words, the number of vaccination stations at hospitals will be increased to 9. I do believe that these stations will provide a lot of convenience to patients who need to go to public hospitals for follow-up, or those who are chronically ill, and those who are elderly. The fourth way is to make appointments with private doctors or clinics who participate in the vaccination program. They may receive CoronaVac in the private sector. Starting from 9 a.m. this Friday, the web page of the dedicated website will be updated. Those who need to make an appointment only have to choose the specified group at the website when they make an appointment. There is no need for them to upload any documentary proof. On the day of vaccination, when they arrive at the vaccination centers, they will be asked by staff members to produce documentary proof for verification. For those who are immunocompromised, after they have received the second dose, they have to wait for at least 4 weeks to receive the third dose. They need to take with them doctor's certificate to prove that. A template or sample of doctor's certificate will be uploaded to the dedicated website shortly. For those who are between the age of 12 and 17, they need to bring with them on the day of vaccination consent from their parents, and they have to be accompanied by parents to go to the vaccination centers to receive the vaccination. You'll find the template of a parental consent at the dedicated website. In relation to those who are exposed to high infection risk or those who are above the age of 60, they only need to produce their ID card. For those who are healthcare workers or those who work in high-risk environments, they only need to produce proof that they work in these related sectors or make a statement. For those who have received 2 doses of Sinovac, if for special reason they need to get priority to receive the 3rd dose, say for example if they need to travel to high-risk areas within the short run, they may take with them their air ticket to vaccination centers. We will deal with their cases on a case-by-case basis. Well, we will, as I said, give priority to those who are exposed to high risk, those who are chronically ill, and those who are exposed to high infection risk at their work. For those who are chronically ill, they need to first consult doctors as to when they can receive the 3rd dose. To give them convenience, there is no need for them to produce any proof. For Comirnaty, it can be used on those above the age of 12. For Coronavac, it's suitable for those who are above the age of 18. There are still lots of people who have not received any vaccination, especially those above the age of 70. We'll all work together to boost the vaccination rate among elderly people because they need the protection afforded by vaccination. From now to the end of December, there will be 21 community vaccination centers operating. I ask you all to make use of the time when these centers are still running to receive their 1st or 2nd dose. For those in specified groups, please check the date when you receive the 2nd dose and go to receive the 3rd dose at the right time to give yourself better protection. We need to boost the vaccination rate and to build a sound protective barrier so that economic activities and social activities can resume normal. We all have to work together. Thank you very much. Now is question time. Please identify your organization and keep your questions short. The lady over there, the lady on the side. I'm from RTHK. I'd like to ask, in relation to these priority groups, how many people are there? What is the stock of Comirnaty? Is that enough? In the end, do you hope that everyone's will receive the 3rd dose? What if there is not enough stock for Comirnaty? Will people be forced to get a Coronavac? Now there is the compulsory use of Leave Home Safe app as well as the 3rd dose. Are you getting ready for opening of closures? Is there any chance that the border will open before the end of the year? For the 3rd dose, it will be available for people in specified groups. We're talking about 1.86 million people. That include those who are above the age of 60, amounting to about 125,000 of them. Those who are healthcare workers, those personnel who are participating in anti-epidemic related work, personnel providing cross-boundary transportation or working at control points and ports, as well as those who are exposed to higher risk. We're talking about altogether 1.86 million people. The recommendation of the Joint Scientific Committee and the Expert Advisory Panel is that there should be priority given to those who have received 2 doses of Sinovac, as well as the 3 groups who are high risk, that is those above the age of 60, those who are healthcare workers, and those who work in high infection risk conditions, as well as those above the age of 60. After that, we may open the program to those who have received 2 doses and have waited for 6 months. The recommendation for those who have received 2 doses of BioNTech, the arrangement is the same as those who are under high risk. We'll continue to go over data, evidence, and statistics. Should there be any new recommendations of the experts, the government will take them into account. In relation to the inventory or stock of BioNTech doses, we have ordered 7.5 million doses. They have all arrived. We have about 1.7 million doses in stock. That is in relation to Comirnaty, that is BioNTech. As I said, there will be about 1.86 million people in the priority groups. But some of them have yet to wait for 6 months. So the vaccination will be done by stages because some of them will have to wait. We'll monitor demand and supply. If need be, we will talk to pharmaceutical companies. We'll see if we need to order more vaccines. In relation to the 21 community vaccination centers, they have the capacity to handle demand. The daily doses administered is less than 10,000. They have a capacity of 26,000 per day. That doesn't include 10,000 doses administered by private clinics. So we have spare capacity. In relation to the administration of the 3rd dose, is based on science. There is such a need, and the government has taken into account the recommendation of experts. There is no direct correlation with the opening of the boundary or the borders. Everything we do is to effectively fight the epidemic and to build a sound protective barrier. We aim to resume normal activities, to open the border with the mainland and with the rest of the world. In relation to other anti-epidemic measures, say for example, the use of Leave Home Safe app when entering government premises, that's one of the measures I'd like to supplement in relation to anti-epidemic measures. In relation to our tightening of various measures, you may have questions. The strategy we have chosen is to achieve zero infection. We have achieved that in Hong Kong. We have not had a local case for quite some time. When the objective is to achieve zero infection, it is not just to achieve zero infection, we have to sustain it as well. We have various measures, say for example in terms of prevention of imported cases and prevention of local outbreak. We have been making adjustments in order to sustain the zero infection target. As I've said, the risk outside Hong Kong is rather high. There are places who have chosen to coexist with the virus. In these places, we see a spiked number of cases of death as well as infection. In Hong Kong, we have single-digit infected cases. But these cases are picked up when people are in quarantine, after they have arrived in Hong Kong, or they are picked up at the airport. We will constantly fine-tune our measures to keep the risk to a minimum.
Next question, please. The lady in a white jacket at the back. Good afternoon, secretaries. I'm from Cable News. Would you recommend a mixed jab for elderly people? Would the immune response be greater than receiving the same vaccine? And is it safe for elderly people? According to the experts, those who have received a Sinovac can choose to be vaccinated for BioNTech, but not otherwise. Why is that? And also, would you only consider someone fully vaccinated only if they have been vaccinated for the third dose? Will there be a fourth or even a fifth dose? I will take the question first. The recommendation made by the experts and the arrangements adopted by the government is that for those who have received 2 doses of Sinovac or those who have received 2 doses of BioNTech who need to get a third dose, that is people in the specified groups, they can choose Sinovac or BioNTech for the third dose according to their own preference. According to the experts, if the third dose is BioNTech, the immune response would be stronger. However, this is your personal preference. You can choose Sinovac or BioNTech as your third dose. For those who have received 2 BioNTech doses, it would be fine, of course, to choose BioNTech as the third dose. However, you can also choose Sinovac for your third dose. This is all about your personal preference. Experts have considered the science and the safety for this arrangement. And also, you can choose according to your own preference. I would supplement on this matter. You ask whether someone who has received a third dose would be considered fully vaccinated. At present, the third dose is an additional dose. Under our present anti-epidemic regime, it doesn't change the definition of fully vaccinated. In other words, if you have been vaccinated for 2 doses, you are considered fully vaccinated. However, the experts have looked at scientific data and they recommend an additional dose for some people. I will not repeat the details. In other words, it won't change the definition of fully vaccination, that is at 2 doses. Director, the 2 vaccines have been widely used in the world. They are definitely safe. The experts have made reference to data. It shows that if there is a third dose, the antibody level can be boosted. Having balanced the factors, the experts consider that if the third dose is a mRNA vaccine, that is BioNTech, the immune response generated would be stronger. Vaccines can initiate or invoke a T cells response that would prevent or minimize serious complications or fatality. So considering the immune response, the experts consider that mRNA vaccines are preferable. However, it is also your personal preference. The immune response or the response after being vaccinated would be different. For those who have been given Sinovac before, they can choose Sinovac for the third dose because the response would be more mild and would be milder, and the vaccination area would be less painful. Some people who have been vaccinated with BioNTech have experienced stronger response. For these cases, they may choose to switch to the other vaccine. Next question, the lady in the middle. Good afternoon, Secretaries. I'm from Mingpao Daily. You said the community vaccination centers would be in operation until the end of December. So when should people get vaccinated for the third dose? And to play safe, should everyone be vaccinated for the third dose? And is there a timetable for that? Second question. In terms of the procurement strategy for the second generation vaccines, what is the strategy? And also, should everyone be vaccinated with the second generation vaccines, which can prevent against the Delta virus? Last year, the Finance Committee approved a funding for the government. So how much has been spent on the first batch of 15 million doses? And how much more do we need? The vaccination program has been running for a year. In terms of scientific data, those who have been administered Sinovac would see the antibody level drop quite quickly. So would the government still procure Sinovac vaccines? Or would you procure more BioNTech? The Secretary has said that we would consider 4 vaccine technology platforms. So in future, would you consider procuring from vaccine platforms other than Sinovac and BioNTech? That is, for example, adenovirus vector vaccines. I will take the question first. The 21 community vaccination center, like I said, would operate until the end of this year, not November, but December, end of December. Later on, we would further announce the arrangements for community vaccination center next year, since January. Starting this week, the operating hours have been adjusted. Monday, Tuesday, Thursday, and Friday, they would be operating from 10 to 6. For Saturday and Sunday, they would operate from 8 a.m. to 8 p.m. So all 21 community vaccination centers have a daily capacity of 26,000 doses. So in November and December, the vaccination centers will have adequate capacity for those who are in the prioritized group for the third dose. We encourage them to do so quickly because we have the spare capacity. Meanwhile, there are 1,000 private clinics which provide administration for Sinovac vaccines. Starting next January, I expect fewer community vaccination centers in operation. It may come down to single digits. The 21 vaccination centers have been operating 7 days a week without any break, so it is not sustainable in the long run. The first dose vaccination rate has reached 70%. In terms of utilization of resources and the actual demand and supply, it is only reasonable to reduce the number of community vaccination centers. The details would be announced in due course. Besides community vaccination centers, we have other platforms for vaccination, including private clinics and vaccination stations in public hospitals. The number will be increased to 9. These will continue to operate. So we will maintain operation for these platforms. And also in the private sector, there may be clinics or hospitals with the capacity to offer BioNTech vaccination. So we are working on that. In other words, there are a number of platforms available for vaccination. So the message is for those eligible persons who have not been vaccinated for the first and second dose, please do so quickly. For those under the specified groups prioritized for the third dose, please do so quickly as well and get vaccinated before the end of the year.
I will reply to your question about second-generation vaccines. The government has been monitoring the situation. Say, for example, different brands, different platforms, and their R&D, the research and development. As to whether there are available vaccines, those that are of the second generation, those that are more effective against mutant strains, we will monitor the situation. We will provide data for the experts to study. It is premature to say anything. We need to look at data. We've been monitoring the immune response of those who have been vaccinated. As I said, we closely monitor the development of second-generation vaccine. So rest assured that we will closely monitor the situation. You don't have to worry about funding. First, we have sufficient stock. The Finance Committee has recently given us funding approval to procure 15 million doses. We'll closely monitor the situation. And of course, it depends on the choice of vaccine of the public. Whether we will continue to procure the existing Sinovac or BioNTech vaccines. Funds under the Food and Health Bureau has been supporting research done by universities in relation to these vaccines, say for example with the situation of mixed dose and the immune response, etc. Hundreds of millions of doses of these vaccines have been administered all over the world. We've been closely monitoring data in relation to safety, efficacy, etc. So far, we have not identified any major problems. Now, there is a need to arrange for an additional dose for high-risk groups, and we have made the arrangement to do so. Previously, we tried to procure vaccines from the 4 different platforms. It was at an early stage, and we did not know much about the research of these different platforms. In order to secure sufficient vaccine, we considered whether to diversify. At that time, there was no certainty as to whether the research of a certain platform would be successful. We have chosen these 2 platforms. The safety and efficacy are guaranteed. There is no need to shop for a different platform, but as I've said, we closely monitor the research of done in the rest of the world, whether there are better platforms. Let's take an English question. The lady with long hair, second row.
From the South China Morning Post. Will the booster shots be made mandatory for any of the 3 priority groups in the future, especially those working in settings with higher exposure to the disease, like airport workers, quarantine hotel workers? And will there be any incentives through the vaccine bubble mechanism to encourage people to take the additional dose? Second is there's been talk of extending the mandatory use of the Leave Home Safe app to Type B restaurants. Can authorities confirm this, and will it be done this month? And there are also reports that a limited scheme of quarantine-free cross-border travel that allows 1,000 people per week for businesses, family, or compassionate reasons to start at the end of the year. Can authorities confirm this? And can you tell us whether when the second meeting between local and mainland health experts over the resumption of cross-border travel will take place? And sorry, I'd also like to clarify one more thing. So for the people who are not in the priority group and need to take the third dose for special reasons like traveling, requests will be handled on a discretionary basis. Who will give that discretion? Thank you.
Let me answer the last part of the questions, and for the rest, Professor Chen would answer. Now, for those who have taken 2 doses of Sinovac vaccines, the experts' recommendation and the government agree that they are recommended to take the third dose. But as a first step, we would arrange for the third dose vaccination for the priority groups, as set out at this press conference. So for those who have already received 2 doses of Sinovac vaccine and not in the priority group, but with some very strong justification, for example, after 6 months having received the second dose and need to travel to some places of very high risk, then they can go to our vaccination center and present the necessary documents, and we will exercise discretion on it. The on-site staff, the on-site operators would arrange that. The basic principle is that we want to make clear about the priority of receiving the third dose, and hope the public will understand that. But if there are some genuine cases, then we would wish to be flexible and act in a reasonable way. So that's the principle.
Okay, your few other questions. First of all is whether we will put these high-risk groups third dose vaccination mandatory. I think the announcement is now, for from the Joint Scientific Committee is to recommend the different high-risk groups to take the third dose vaccination, BioNTech as well as Sinovac. So we'll obviously monitor the situation of whether people are taking it, and in fact, I think many people have been asking for it. So we anticipate the response in booking to take the third dose will be monitored. But as many people have been asking for it, I think it should go well. Second, I think you also asked about the Leave Home Safe. Now, as far as the Leave Home Safe app is concerned, please note it is not new. It is something that was rolled out in 2020 November. And the purpose, if you recall, the purpose is really to help with the epidemic situation. That is, when people go into a place and if they use that QR code, then the individual would be able to have a collection of places where they have been, first of all. So in case when there are contact tracing work ongoing, then they will be able to provide these information more readily, so that it will help the cutting off of transmission chains. Secondly, I think it's also would help if one has been to a certain place, and if there are confirmed cases there, then people would receive notification to go for compulsory testing. Again, this would help the epidemic control situation. So we have been encouraging the public to use Leave Home Safe, and most recently the government buildings have been people would have to use Leave Home Safe when they enter the government buildings. Regarding restaurants and other scheduled premises, obviously we have been looking into these places. And in fact, the more places that would require the use of leave home safe, the better it will help the epidemic situation and also, contact tracing. The government would monitor, the current situation and will adjust whatever epidemic control measures, including leave home safe or other measures as necessary. As far as the resumption of border control of cross-border travel, obviously the Chief Secretary has led a meeting towards the end of September, and there has been a very constructive discussion, and we have been looking into the different measures that we have discussed, and also learned from the mainland in terms of their control measures or different control measures. So I think the communication is ongoing, and as you might have noticed, we have also tightened a number of our epidemic control measures in the past while. So we will continue to review the situation, and hopefully, we would be able to create in a better position create a better position for facilitation of the cross-border travel.
好，下一個問題，第二位。
Next question, please. The gentleman in the middle. Or the lady. I'm from Oriental Daily. For those who have received 2 doses of BioNTech who are at high risk, would they be given priority for the third dose, or would they get the third dose later? For those who have been vaccinated, AstraZeneca or the Johnson vaccines outside Hong Kong, if they have come back to Hong Kong and they are immunocompromised, would they be eligible for the third dose? When we mentioned high-risk groups, including those above the age of 60, healthcare workers, or those whose working condition is highly exposed to infection. These people, whether they have been given 2 doses of Sinovac or BioNTech vaccines, they would be eligible for prioritized vaccination for the third dose. That's the first question. Second, for those who are eligible for the third dose under the criteria I mentioned, if they are Hong Kong permanent residents, if they have waited 6 months after the second dose, then they can receive a third dose. Next question. The lady in brown.
Several English questions. First, very common question. Looking forward, would it be necessary for all Hong Kong citizens who have received 2 doses to get the third dose? And when would that next step happen? Would it be early next year? Is there a timetable? And second question, what would happen when we kind of run out of BioNTech vaccines? As you said, we only have around 1.7 million doses left. My third question is related to the possibility that that the Leave Home Safe app would be required at restaurants. Have the government kind of been in contact with restaurants on what they think, and how would you respond to some of the concerns raised by the restaurants that they are afraid that they will be penalized if customers use the fake version of the Leave Home Safe app, and they may end up having to shut for 14 days? What will you say to some sort of these sorts of concerns? Thank you.
Okay. So I think as the Joint Scientific Committee recommendation has already said, first of all, for people who have had 2 doses of Sinovac, they are recommended to have the 3rd dose. Our first phase now, as announced by Patrick Nip just now, as Secretary, that is for those high-risk groups to take it first. As far as BioNTech is concerned, I think again, now if you have taken BioNTech and if you are high-risk groups, then again, you are recommended to take the 3rd dose. For those who have taken BioNTech but not the high-risk groups, I think we will look into the more data. The Joint Scientific Committee and our experts would look into before any further recommendation. Second, as far as the supply of BioNTech, yes, right now we still have enough stock, but we'll monitor the situation. And in case, it is running low or running out, then obviously we will procure, enough vaccines for people who need it. Third, as far as the Leave Home Safe is concerned, the use of Leave Home Safe, I have already earlier reiterated the purpose of Leave Home Safe, and that is to facilitate the epidemic control. So in theory, the more places that people would use Leave Home Safe, the better it is to actually help in contact tracing and also epidemic control. Yes, I understand colleagues have been sort of sounding out the different scheduled premises in terms of the feasibility of using Leave Home Safe and trying to gather, people's comments and also views. We'll also obviously take into consideration the current use of Leave Home Safe in restaurants already, as well as the most recent use of Leave Home Safe in the government buildings, and we'll take all that concerns into consideration. Of course, using any fake Leave Home Safe is not right, and we do not encourage people to do that whatsoever. Thank you.
好，咁我哋答多兩位朋友嘅。
Let's take 2 more questions. The gentleman at the back. Good afternoon, I'm from Now TV. Secretary, you said there is 1.7 million doses of BioNTech vaccines left. However, there are 1.8 million people eligible. So if fewer than 160,000 people choose to switch to Sinovac, then you would run out of BioNTech vaccines. So have you engaged in an arrangement with the manufacturer rather than wait till you run out of stock? And also there are rumors that Leave Home Safe, the usage of Leave Home Safe app would be extended to Group B restaurants. So is that true? And do you worry that there would be the members of the public would oppose to it? And also, it is said that there would be a requirement to handle visitors from the mainland and overseas separately. So is that true? Is that also one of the conditions raised by mainland experts? On the supply of BioNTech, today we have just announced the specified priority groups. We estimate that there are 1.89 million people under these groups. This group of people have to wait 6 months after the 2nd dose of vaccination. So not all of them are eligible for the 3rd dose yet. That is the estimation. Currently, we have 1.77 million doses of BioNTech vaccines. In the short run, the supply is sufficient. Of course, we would keep monitoring the situation. We are keeping in touch with the manufacturers all along. We would look at the supply and demand and make suitable arrangements. Your question was about Leave Home Safe. Like I said previously, it is not something new. In November 2020, we rolled out the app. The purpose is, with the app, it can facilitate contact tracing when we have an infection. And also, if members of the public have been to a place where an infected patient was present, then the Leave Home Safe would prompt the person to get a test. It is very useful for personal protection as well as epidemic control. We have been encouraging members of the public to use the app all along. At present, more than 6 million people have downloaded the app. Starting Monday, the government has implemented the mandatory use of the app at government venues. For catering business, Group C and D restaurants must use the Leave Home Safe app. Now we are just talking about Group B, whether the requirements would be extended to Group B. Of course, we hope more venues would use the app to facilitate contact tracing and to offer protection to their customers. This is something that we have been appealing for the public to do. For specific venues like Group B restaurants, we are conducting a sounding out exercise to listen to their concerns. We will communicate with stakeholders of different premises. We will also monitor the developments of the epidemic. For Group C and D restaurants, we are dealing with them under the principle of a vaccination bubble. We would adjust the measures timely. On the usage of Leave Home Safe app, it would be subject to different factors and review, and we would announce the updated arrangements in due course.
而家咧喺全世界各地咧嗰個新冠肺炎咧嘅肆虐咧嘅情況底下，同埋變種病毒咧係咁犀利咧，其實我哋都係非常之高風險嘅咁所以咧喺機場入邊嘅每一個環節係唔係隔離某一啲嘅入境嘅人士啊，以至到係整個機場嘅感染控制啊，每一個流程嘅安排啊，呢啲咧其實咧我哋嘅衛生防護中心啊、港口衛生啊，同埋咧機場管理局咧，其實大家咧都係悉心咁樣咧係去留意同埋監察每一個細節嘅。咁所以喺做一啲有效嘅分隔咧，其實咧
as well as port services are working together. If we can put in place effective anti-infection measures, that would be good. As you can see in other airports, they have some kind of segregation arrangements. We have to tighten our measures and guard against infected cases to stop them from creeping into our community. Arrivals at the airport or people who work at the airport might be subject to tightened measures. Last question, the lady at the back in the third row. From Stan News, 2 questions. I see in the press release that those who are above the age of 18, those who have received 2 doses of Comirnaty, if they are subject to additional risk, they may receive another dose of BioNTech or Sinovac. Previously, there are press reports saying that the Joint Scientific Committee does not recommend the use or the switch to Sinovac. Is that your position, or is it the case that if members of the public choose a Sinovac as their third dose, it doesn't matter? I'd like to ask Dr. Choi, in relation to the change of discharge conditions, have you asked the Joint Scientific Committee about this? Has there been any prior consultation? If there is none, does it mean that administrative order has superseded scientific evidence? There is no local outbreak and no local case, and yet you tighten the discharge conditions. Does it mean that previously, when there was an outbreak and we had those discharge conditions, it means that these conditions are actually in order? The CHP, as well as the Department of Health and the hospital authority, have regularly discussed about conditions for a discharge from hospital. There has been adjustments from time to time, so this is not the first time when it is adjusted. In relation to our anti-epidemic measures, as I said, our strategy is to achieve zero infection. It's not just to achieve zero infection, we have to sustain it. We have to minimize risk and keep the risk under control. There has been previously some cases of retest positive. You might think that recovered patient might not transmit the virus, but there is always a chance. We have to guard against imported cases and prevent local outbreak. That's why we have to tighten the criteria for hospital discharge. We've added 14 days of monitoring and surveillance. If it makes the public safe, I'm sure that it is the expectation of the public. I would like to say something about the discussion of the Joint Scientific Committee in relation to the third dose after receiving 2 doses of BioNTech. They have looked at data on antibodies locally and overseas. We're talking about those in a high-risk group. The recommendation of the committee is that if the third dose is BioNTech, the boost of level of antibodies is the best. If you're using one platform, it's very rare that they will switch to a different platform. But there are cases in which one has a strong or adverse reaction, so they might decide to switch to a different platform. Say the first dose is BioNTech, and the person suffers from serious reaction. The doctor may suggest switching to a different platform. It depends on the personal experience of the vaccine recipient. That's why we provide the flexibility to switch to a different platform. Experts looked at the increase in level of antibodies when they look at the data. But there may be a personal situation and that will warrant a switch to a different platform. That's the end of the press conference. Thank you.
到時話你知。